I even developed a pamphlet here, as you can see. The pamphlet says, Discover 10 Astonishing Truths About Hormonal Imbalances That Could Change Your Life. And we make this available to all of our new and existing patients. So there's the little sample of that pamphlet for you. And this pamphlet is great. It goes through a lot of really valuable material. Let's kind of get started. Okay. There's not a lot of things that your healthcare provider is completely clueless about, unfortunately. So according to conventional wisdom, the hormones are no longer, you know, as plentiful in the body for a woman once she reaches menopause. So I know we're not really talking about menopause right now. We're talking about infertility. We're talking about 18 causes of infertility that your healthcare provider not only doesn't want you to know about, but they don't know about themselves. And they don't know about it because it's not taught in medical school, and it's not really taught as part of the standard conventional education, despite it being 100% scientifically valid. Okay. So first of all, there's a idea going around that at the time of menopause, when a woman is no longer cycling and has released all of her eggs, that she's no longer able to establish progesterone levels in the body, and so she just doesn't need progesterone, and so all she really needs is estrogen. So I have no idea where this kind of nonsense, craziness, crazy talk came from, but there is no place for this type of thinking in the actual world of science. Okay? So you can't make estrogen without progesterone. You can't make testosterone without progesterone. You can't make DHEA, an important sex and steroid hormone, without progesterone. You can't make cortisol which is the main stress hormone, without progesterone. You can't make aldosterone, which is a mineral corticoid that helps with sodium-potassium balance and mineral balance in the blood, and also with blood pressure. So you can't do that. There's a variety of mineral corticoids. Aldosterone is the main one. You can't make, dihydrotestosterone. You can't make corticosterone. You can't make you just can't function, okay, without progesterone. So no, you still have to have progesterone in the body, even after you're no longer able to produce ovarian progesterone, because the ovaries aren't producing progesterone, but it can still be produced in most of the fleshy cells of the body, and it can be produced in most of the cells of the body, not all of them, but most of them. And it can also be produced in the adrenal glands. Okay, so unhealthy adrenal glands will tend to lead to a lot of symptoms that women have, such as, in menopause, such as hot flashes and night sweats and that kind of thing. Okay, so I'm glad we got that little bit of science taken care of. The other thing is, most of these hormone tests that they're doing in conventional medicine, which is also called allopathic medicine, are complete hogwash. I mean, they're just not accurate. I don't know what to tell you. So these hormones, such as progesterone, thyroid hormone, testosterone, they travel in the lymph system, the lymphatic system. So they travel in the saliva. You can get the ranges of these hormones that are active hormones that actually create change in the body, physiologic change. They're called free hormones or active hormones. You can measure them by doing a saliva test. I recommend Diagnostics, but you could use another company like Metametrics or another company. So I just recommend Diagnostics. I just like them. They do the most number of saliva hormone labs. They're the leader in the field. They've been doing it the longest. They're the most accurate. That's why I like them. Okay? So I hope this part's been helpful. Let's see, what else should we talk about? So they're inaccurate conventionally because they're doing blood labs and the hormone doesn't travel in the blood. The only hormones that travel in the blood are called the bound hormones. They're the bound inactive hormones. They're the ones that are bound to a protein. So these don't create any physiologic change in the blood, any physiologic change in the body, and the target cells or glands where they're targeted to go to. In this case, we would be talking about, what would we be talking about? We'd be talking about estrogen. Estrogen tends to create a lot of changes in the uterus and a lot of changes in breast tissue, mainly. Creates lots of changes all over the body, but kind of talking about the cells that are involved. It even creates changes in the brain to some extent, so, it creates lots of changes. And then progesterone would be somewhat similar. Progesterone also creates changes in the vulva, mainly talking about females. They create changes in males too, which are really important. It's just not what we're talking about right now. Okay, so again, the labs that are done are a joke, okay? They're not looking at hormones that create changes in the body. So a lot of times women, the doctor says, okay, we've done the lab and we found that you're normal, you don't have any problems, you don't have any imbalances, so, either it must all be in your head or there's nothing really we can do, we don't have any options. Well, of course there's nothing they can do because they never did the proper lab to find out what's wrong, to figure out what needs to be done, right? They never did the saliva lab. And even if they do the saliva lab, they don't have the proper training and skills to read the lab, diagnose what's going on. Not that you would diagnose from a lab, but even if they were going to try, they don't have the skills and trainings to be able to read the lab and understand what to do about it, right? They don't have that skill set because they're treating symptoms, they're treating labs, they're not treating the patient from which the labs are drawn. They're just treating the symptoms and pieces of paper instead of real people and being able to look at function that's normal, healthy function. They're looking at disease dysfunction, pathology, death, whatever. They're looking at all these kind of really severe, serious conditions that require immediate intervention, whether it be hormone replacement therapy or another. Usually that's what it is, right? Some kind of drug like thyroid hormone or estrogen or progesterone, or a compounded drug made from a compounding pharmacy, which may not be possible soon because of new legislation that's being passed. At any rate, that tends to be what they do. So we've kind of gotten started with infertility, but we haven't really gotten too far. So we'll have to continue on the next video. Again, my name is Dr. Ilya Skolnikov. I'm really excited to have brought you this information, and I'm looking forward to continuing to bring you this information. And this is something we've helped people with for many years in the office. Tons of women who weren't able to get pregnant, went to fertility clinics, didn't even get help there, and we were able to help them. Thank you.